Good afternoon, everyone. And I want to begin by acknowledging that we are on Treaty 1 territory, traditional lands of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene people, and on the homeland of the Métis Nation. So if you're just joining us, when I exited the legislative building, I was immediately moved by your presence. And I walked down the steps and I looked at the faces in those photos. And we want to see more than just photos. We want to see lives behind those faces. Someone's sister, someone's brother, someone's cousin, someone's child. And I want to say, I just thank all of you for taking time out of your schedules to be here today and to support those who have lost loved ones to overdose. It's my pleasure to be here with you to recognize International Overdose Awareness Day, and my office has proclaimed August 31st as International Overdose Awareness Day in Manitoba. Thank you to the organizers, Overdose Awareness Manitoba, for arranging today's event, and to everyone, once again, who's taken time to join us. This is a day for us to raise awareness about overdose. It's also the time for Manitobans to commemorate those lost, as I said before, to drug overdose. May we all empathize with the grief felt by families, friends, and communities when remembering those who have died or have been permanently injured as a result of drug overdose. On this International Overdose Awareness Day, I want to remind individuals who use substances that they are valued. Addressing the growing concern of overdose and improving the health and well-being of Manitobans is a priority for the Manitoba government. We recognize that strong mental health and addiction services system is a key component of our healthcare system. And I've said many times in the chamber that there is no health without good mental health. I would like to take this opportunity to highlight some of the actions that our government has undertaken to address risk of overdose. People who are at risk of opioid overdose may access free take-home Naloxone kits and get information on overdose recognition and response at many distribution sites throughout our province. And there are currently 140 take-home Naloxone program locations, and they're spread across all 5 health regions and 31 First Nations across the province. As well, Naloxone has been reclassified to expand access and to allow designated frontline social service providers to distribute Naloxone kits where they're needed the most. Kits are now permitted to be sold at several retail locations. This reclassification removes barriers and reduces deaths related to opioid overdose. In the last 6 years, a 6th Manitoba Rapid Access to Addictions Medicine, or RAM clinic, was opened in Portage-la Prairie. There are also 2 RAM clinics right here in Winnipeg, and 1 each in Brandon, Selkirk, and Thompson. RAM clinics provide immediate counseling, connect patients to community treatment programs and primary care physicians, and prescribe appropriate addictions medication, including opiate agonist treatment. And I was pleased to advocate on your behalf and the behalf of many other Manitobans to have a recent investment of $819,000 to expand the services offered at Winnipeg's 2 RAM clinics to address the increase in need during the COVID pandemic. Flexible length community residential withdrawal management services have been implemented in Winnipeg and Brandon. As well, Clinic Community Health's flexible length mobile withdrawal management services was recently expanded in Winnipeg. Through this mobile service, individuals can go through withdrawal in their own home or another safe space. These developments build on other recent investments in Manitoba, including over $50 million for 53 different initiatives to improve access to mental health and addictions. And these services are across the province. These are just some of the changes that have been implemented to support recommendations from what you all know is called the Virgo report. and it's intended to increase capacity for harm reduction and addiction supports and services. And several reports, as you know, have been commissioned and submitted, including the Virgo report. And those recommendations have been partially or implemented, or they have been fully or partially implemented by our government.